Hi, my name is Buck Black, and I'm a therapist in Lafayette, Indiana. I want to speak with you today about anger management. It's important to point out that there is such a thing as healthy anger. Anger is a natural emotion, and we all have it, and when you express it in a controlled fashion, you can stand up for yourself, you can do things to make the world a better place, such as creating laws, or changing policy, or, just a whole variety of things. When a person comes to my office for an anger management assessment, we take a look at what is the root cause of the anger. Anger is never a primary emotion. There's always some other emotion that is driving it. Some of the things that I screen for in an anger management assessment would be, do you have a history of head injury? Can you think of a time that you have hurt yourself? If you have damaged the prefrontal cortex of your brain, which would be behind your forehead, that can make it more likely that you will have anger management problems. Are you abusing substances? Maybe it's alcohol, maybe it's some other drug. Again, that makes it more likely that you can become angry. Maybe there is some kind of mental illness, depression, bipolar. Those are a couple of diagnoses that often can cause anger, and they would need to be treated primarily. It's important to point out that the angrier you get, the dumber you get. The brain is just not wired to be angry and logical at the same time. What I often do with my clients is I have them keep track of their anger in a journal. So if they go from day to day logging how many volcanoes that they've had in a day, so up to 100, that would be a really bad day. That helps them to keep track of what their triggers are. Once they have identified what their triggers are, I help the client to stop their anger before it gets all the way to a 10 or to 100 volcanoes. I have them intervene much lower, like at a number 2 or 20 volcanoes, because that's something that can help the client if they intervene when their anger is at a much lower level. I also help clients take a look at their indicators of anger. So a lot of times a client will become angry and they won't realize that they're angry until they're already there. So we'll look at, how does your behavior change when you very first start to get angry? Do you start to pace? Maybe you stare at other people. There's a whole variety of behaviors. Maybe it's clenched fists. The cognitive indicators of anger is, okay, are you starting to think these negative thoughts? What is it that's going on in your head? So again, the quicker you catch this, the quicker you will be able to control your anger. And then the somatic piece, that would be your body. What do you feel in your body when you start to get angry? Maybe it's something in your chest or in your stomach. Maybe it's tightness in the muscles of your neck. So these are all indicators of anger. And if we do an anger management assessment and then talk further about that, you will be able to map out what starts to make you angry, and you stop at 20 volcanoes instead of letting it get to 80 or 90 volcanoes before you realize that you need to do something to address your anger. Thank you very much.